All right, it looks like we've got a few more people trickling in. So I'd like to thank everyone for joining us today for today's webinar, recapping the Lung Association's 2023 state and federal lung cancer advocacy strategy to date. I'm Alicia Nichols, and I serve as National Senior Director of Corporate and Foundation Relations and have the pleasure of working directly with many of you and your colleagues on pressing lung health issues that impact our most vulnerable patients. Today, we're excited to highlight the work and activities generously made possible by our sponsors, as well as our advocacy plans moving into 2024. Just so you all know, this webinar will be recorded and made available to share with your colleagues and those who were not able to join us live. And the presentation will be followed by a Q&A session, so please feel free to drop your comments directly into the chat. And with that, I will turn it over to Erica Sward, our National Assistant Vice President of Advocacy, and Hannah Green, our National Senior Director of Policy.
Wonderful. Thank you so much, Alicia, and thanks to everyone for being here. I want to especially acknowledge AstraZeneca, Bristol Myers Squibb, and Sanofi for your support of our lung cancer advocacy strategies. Also, our very wonderful Lung Force Advocacy Day sponsors, who we also invited to today's call. So this is certainly a great collaboration, and we couldn't do this without you. So we are very excited to talk with you today about our advocacy and policy work in the lung cancer space, and wanted to give you just a brief overview of the work that we've done over the course of this last year, along with and refresh you a little bit on our primary objectives. As we all know, lung cancer screening is not utilized enough. It has the lowest utilization rates of any of the cancer screenings, and is unfortunately still in the single digits. But regardless of that, as you all know, the lawsuit Braidwood v. Becerra, which I'll talk more about in a minute, is a huge threat to both lung cancer screening as well as all preventive services. And our ongoing work to protect lung cancer screening without cost sharing and promoting implementation of these guidelines remained a key part of our work this last year. Our second strategy is really around ways that we can work to increase early diagnosis for lung cancer patients who do not fall into the USPSTF designation of high risk. We certainly have a whole host of lung force heroes who, particularly younger women who did not smoke or have other apparent risk factors, and they are certainly very eager, as are all of us, to understand a little bit more about how their lung cancer can be better understood, why it originates, and also what can be done for an earlier diagnosis. Also, as a result of your support, we were able to commission a study with Avalier that Hannah will share a little bit more with you about in a moment, that really aims to zero in on quality and affordable health insurance coverage for both lung cancer diagnostics as well as lung cancer treatment. And then finally, we want to share a little bit more about our efforts at the state level about improving coverage and also access to biomarker testing. Next slide, please. So I'm going to talk a little bit more about our efforts at the Lung Association to safeguard coverage. And as I know that I have shared with so many of you, the real concerns the Lung Association has about the Braidwood v. Becerra lawsuit, and its challenge to the Affordable Care Act's requirement that most health insurance plans cover preventive services without cost sharing. And that cost sharing piece is particularly important. Earlier in March, a district court in Texas ruled that all ACA compliant plans are no longer required to cover preventive services recommended by USPSTF after the enactment of the ACA in March 2010 without cost sharing. We are very concerned about the impact of Braidwood on the cost-free coverage of lung cancer screening, which was first recommended by the USPSTF in December of 2013, so 3 years after Congress passed the ACA. In April, the Lung Association led an amicus brief with major public health groups urging the Fifth Circuit Court of Appeals to issue a stay in this case so that cost-free coverage would not be jeopardized as the case works its way through the legal system. The court finally issued a stay in May, and in June, we led another amicus brief on the merits of the case, urging the Fifth Circuit to overturn the lower court's ruling on coverage of the USPSTF services recommended since 2010. We have also led a number of statements from the patient community throughout this legal process, and in May, we released 2 new resources for states to help understand their options to protect and expand cost-free coverage of cancer screenings and other preventive services. All of our resources on Braidwood are available at lung.org/Braidwood. Please feel free to chat in any questions as you have them, and in the meantime, I'm going to turn this over to my colleague, Hannah.
Thanks, Erica. So as Erica mentioned, we have a lot of patients in our community who, don't meet the high risk criteria for lung cancer screening and really want to know and understand sort of what is happening that can help people who have lung cancer like them. And so one of the pieces that we're working on for this fall is an infographic, just like a 2-page kind of summary that looks at what is going on in the research space that it could really help people with, lung cancer, with the risk factors that they have, as well as what is going on in the policy space. What are we advocating for that could really help to make sure that more patients like them have their lung cancer caught early, where we know that the outcomes and treatment options are just so much stronger, and the chance of survival is so much higher. So this is something that we're hoping to release during Lung Cancer Awareness Month, which many of you know, I'm sure know, is this November. So we'll have more to come on that, and be sure to share that with folks as well. Next slide, please. So next, let's talk about this study that we worked on with Avalier over the past few months. This spring, we partnered with them to conduct a study examining how the ACA's essential health benefit standards are working for lung cancer patients in the ACA marketplace plans. So what Avalier did is it looked at the EHB benchmark plans and coverage of services like lung cancer screening, biomarker testing, prescription medications for lung cancer, and other key treatments and services to see, look at the marketplace place plans in 5 states. We chose Louisiana, Maryland, Michigan, New Mexico, and Pennsylvania, and really see, how those are working, those current standards are working and being translated into coverage for the patients that we represent. So we're excited to give you a sneak preview of those key findings right now, and as well as the resulting policy recommendations. And we'll look forward to sharing this report with you before it is widely distributed at the end of the month. So the key findings, first and foremost, is really a lack of transparency in multiple areas. Both the benchmark plans and the silver plans lacked key details to determine whether they met the standard of care for lung cancer. A real failure to keep up with medical advancement. When the EHB standards were first developed, things like biomarker testing were just not available. And so in the past decade, comprehensive biomarker testing has connected patients with lung cancer with targeted therapies that drastically improve their prognosis, but none of the benchmark plans have provided guidance on this testing. Barriers to accessing recommended treatments, so recommended medications for lung cancer that we looked at were not covered by all plans, and often included barriers like prior authorization, quantity limits, or placement on specialty tiers, which, as we all know, often means higher cost sharing for patients. And then finally, just a real lack of oversight and enforcement. Both the benchmark plans and all but one state silver plans were not consistently covering tobacco cessation treatment, preventive service required to be covered under the current standards. So based on these findings, the policy recommendations that we will be releasing include conducting a comprehensive review of the current EHB standards, updating coverage requirements in areas where there have been important changes in science and medicine since 2013, like biomarker testing, strengthening the prescription drug standard, restricting limits on evidence-based care, improving oversight and enforcement of the existing standards. And like I said, we plan to release this study at the end of September so we can share with key decision makers in the administration before the release of the next notice of benefit and payment parameters, the annual rule governing the ACA marketplaces, where we know a lot of the key standards that we're talking about where that rulemaking often happens. Next slide. So the last objective I want to talk about is our state advocacy work, and both sort of on the kind of regulatory front and on the legislative front, we've had some really key victories this year. The Lung Association began tracking Medicaid coverage of lung cancer screening back in 2018. When we did our first analysis, just over 30 states were covering lung cancer screening in their Medicaid programs, and we've seen tremendous progress in that number over the past 5 years. This March, Alaska began covering lung cancer screening. We also were able to confirm coverage in Hawaii this summer, and we're very close, I think, to confirming coverage in Arkansas as well. If we're able to get Arkansas there, then and confirm that coverage, we will be at 49 states, just Alabama to go. And again, considering that we were just over 30 states 5 years ago, I think that's just like a real tremendous success and real fast pace of progress that we're really excited about. Another key area that our staff have been working on over the past year is access to biomarker testing. As I said earlier, we know that access to comprehensive biomarker testing is critical to make sure that our patients are connected to the kinds of targeted therapies that are just really life-changing and making sure that they have much better chances of survival. So this year, we've collaborated on a number of campaigns across the country. Here are some states where we've seen some really great victories: Georgia, Kentucky, Maryland, New Mexico, Oklahoma, and Texas. And we're excited. I know there's some still work going on in some states that have longer legislative sessions. And so really excited by that progress and eager for more victories to come in the next, months and years. Next slide. So before we go into Q&A, we just wanted to talk a little bit about some of our plans for FY24. First and foremost, as Erica said, the work around Braidwood and protecting coverage of lung cancer screening without cost sharing is not going anywhere. If the Fifth Circuit rules, at the end of this year or in early 2024, it likely goes into the Supreme Court. Then we're looking at maybe a 2025 ruling. So a lot of work to do, a lot of time to go to really educate more policymakers and the media and other stakeholders about this case, and to continue our legal advocacy work in this space as well. Another really exciting development that we're looking forward to in the next year is the implementation of the out-of-pocket cost cap on prescription drugs in Medicare Part D for seniors with lung cancer. So starting January 1st, 2025, seniors will not have to pay more than $2,000 a year in their out-of-pocket costs in Part D. For patients with lung cancer who are on, more expensive medications, this could really be a game changer in helping them to afford their care. So we know that over the next year, as we prepare for that, there's going to be really important work to do to both educate our patients about what is coming and what they need to think about in terms of, opting into the smoothing provisions to make sure that they can not just have this out-of-pocket cost cap, but spread those costs out more evenly across the course of the year. And then, of course, there's just the regulatory process. As I'm sure most of you know, there's guidance out right now from CMS about, starting to implement this. That we'll be commenting on. Those comments are due September 20th. There's more guidance expected early next year, so we'll be actively engaged in the regulatory process on this issue as well. Next, educating federal policymakers around policies related to lung cancer screening, access to treatments, and health equity. I think there's been increased interest in this issue and in lung cancer screening in general on the Hill over the past year or so, and so we're eager to take advantage of that. Our State of Lung Cancer report, which comes out every November, is also a really great opportunity to share that with offices and make sure they understand sort of where things are in their state and get them interested and engaged in this issue. And then finally, expanding our state advocacy capacity to advance lung cancer policies that benefit patients and caregivers. In addition to the work we'll continue to do on Medicaid coverage, on biomarker testing at the state level, we're really excited about some states starting to look at investing, state dollars, dedicated funding for lung cancer screening in a few states, and we're eager to continue to build on that momentum. And as well as we think about, next steps with the Braidwood case, I think there's also been an interest in some states in codifying coverage of lung cancer screening and other preventive services at the state level. To be clear, states cannot fix this problem. because they can't regulate all of the types of plans that are covered by the current requirements to cover lung cancer screening without cost sharing. But they can regulate some plans. And so really encouraging states to think about that, as well as to if they do want to work on codifying preventive services, to codify the full ACA benefit package, not just kind of pick and choose individual screenings that they are focused on. So with that, let me just turn it over to Erica to talk a little bit about some other things on the horizon.
For sure. And thank you, Hannah. Kind of building off of our third bullet about educating federal policymakers. While we know lung cancer treatments were included in the initial CMS negotiations list, we will be paying close attention to the unfolding process with the CMS negotiations so we can be prepared if and when they are. And really recognize that part of our work is continuing to understand the patient voice in all of this and to amplify their unmet needs throughout this process. With that, we certainly encourage you to chat in any questions that you might have, and let me turn things back over to Alicia.
Thank you both. As mentioned, you can feel free to just drop them right in the chat. No need to turn off your mute or camera. It looks like we have one question from Mariah.
Yes, so Medicaid has been one of our key areas of focus, but there certainly are other gaps in insurance coverage. One thing that we've been really excited about in the past couple of months is more efforts by the Biden administration to crack down on junk plans, like short-term limited duration plans that don't have to comply with a lot of the current requirements around preventive services coverage. And so really limiting those plans will be a really important step forward in closing some of the coverage gaps around lung cancer screening. Of course, there's always the issues that we have with the uninsured and who don't have access to lung cancer screening. I think even in states that have decided to sort of stand up programs where you can, do a cancer screening, for the uninsured, then the question is, if it's positive, what do you do if that patient's uninsured? Like, what are the other options available to them? And so, that's a reason that, things like Medicaid expansion are just so critical to the Lung Association's state advocacy agenda, and one of our absolutely top priorities at the state level that crosses all of the work we do on lung health for all of our patients, not just those with lung cancer. And then I guess the final thing I'll say about that is I think there's been some increased interest based on some of the work happening for other cancer screenings about thinking about not just the initial screening being covered without cost sharing, but then like follow-up tests, like other additional diagnostic tests that patients need. So that's certainly an area we're exploring, kind of what are some of the options there to help patients with their costs and their coverage. But of course, given the threats we have to the screening itself right now, obviously that is our top priority in terms of, advocacy at the state level. Anything you'd like to add to that, Erica?
I think everything is very much layered here with all of our work and really speaks to why we've tried to really put together this comprehensive approach to our lung cancer strategy when it comes to policy and advocacy work. Thanks, Mariah.
Any other questions before we wrap up? And of course, we can follow up with you all after to schedule meetings to discuss the 2024 proposed work and proposal. And of course, thank you all so much for your time today. You know where to reach us, and we'll certainly be back in your inbox. Looks like we have one more question, not a question, but a thank you. Thank you, Rachel.
Thank you.
We so appreciate it. Hope you all have a wonderful rest of your day, and we'll be in touch soon.